Namaste friends, welcome to Biology Center for True Learning. Here I request you to subscribe our YouTube channel Biology Center for more videos and press the bell icon for latest notifications and updates. In this video, we will going to learn the world most dangerous, the sexually transmitted infection HIV, human immunovirus, which causes acquired immunodeficiency syndrome, shortly AIDS in human beings. Human immunovirus is responsible for HIV infection in human beings. It was first found in the year of 1983. The earlier name of human immunovirus was HTLV3 LAV, which stands for Human T-cell lymphotropic virus type 3 lymphadenopathy associated virus. So later on, this name was changed into human immunovirus. Here, this virus mainly target the immune system of the person. By that reason, the name was given as human immunovirus. There are two types of HIV viruses. One is HIV-1, another one is HIV-2. HIV-1 virus was found in common chimpanzees. Then HIV virus 2 found in Suthi mangabeys. So, which are the world code monkeys? The structure of human immunovirus is given here. This is the HIV RNA. Here the reverse transcriptase process begins. Here this is the lipid layer. This is the integrase. This one is hostile protein. Some kind of antigens also present on the surface of the HIV virus. Let us come to the classification of HIV. As earlier I told you, HIV is divided into two types, HIV-1 and HIV-2. HIV-1 again has four important groups, four strains, group M, group N, group O and group P. Here M is the most predominant. It easily spreads and creates the infection. Again, group M has so many strains called subtypes like A, B, C, D, F, G, H, J, K, CRFS. CRFS means circulating recombinant form. If we want to bifurcate the HIV-1 with the HIV-2, here we go through some points. HIV type 1 is most predominant, spreads worldwide, but HIV is not predominant. It confined to West Africa only. HIV-1 is more virulent, so it is less virulent. HIV-1 is more dangerous and can easily spread person to person. HIV-2 is not like that. It is less easily transmitted. There were 37.9 million people suffered with HIV infection at the end of the 2018. So what was the number of HIV infected persons at the end of 2018 years means 37.9 million people all over the world. Next, the simple question, how HIV infection transmit from person to person? How HIV cannot transmit from person to person? Here answer to the two questions is clearly given. These are the ways by which HIV infection can easily transmit from infected person to the healthy person. Number one, unprotected sex. Practice the unprotected sex without using condoms causes HIV infection. Next, addiction to the drugs. For injecting the drugs, the needles used by the persons, used by other peoples. If the other peoples have the infection, the new person also have greater chances of getting the same infection. Another one is blood transfusion. When the blood is transfused from the infected person to the healthy person, the HIV enters the healthy person. Another one is the pregnancy. If mother has HIV infection, so obviously the fetus also have the greater chances of getting the HIV infection. And the usage of non-sterile instruments, when some instruments used for the surgery purpose of the infected people, if used for the do the same surgery for a healthy person, automatically infection transmits. Here some ways are presented by which HIV do not transmit it from person to person. by giving the shake hand, I mean by means of touch. HIV cannot spread. Then by eating the foods with the infected person also. Then by giving the kiss. Then by bites of the insects and in the pools. These are the means by which HIV infection do not transmit from person to person. There are three stages of HIV. One is acute phase, second one is asymptomatic phase, third one is acquired immunodeficiency syndrome phase. These are the three important phases through which the human immunovirus passes, I mean completes its life cycle. Go through the graphical representation, we can easily understand the different stages in better manner. This much of region acute phase, from here to here asymptomatic phase, from here to here AIDS phase. Here two curves are presented in different colors. One is in red color, another one is blue color. The red colored curve represents the HIV virus, the blue colored curve represents the CD4 plus cells. Here CD means cluster of differentiation. CD means cluster of differentiation. CD is a glycoprotein actually present on the surface of the T helper cells. They are the one type of white blood cells fighting against the infection. The further we will talk about this type of cells also. Let us first watch what happens during each type of cell, each type of phase. So during the acute phase, the flu-like or influenza-like symptoms are experienced by the person. So here the growing of HIV virus is faster, rapid. There is a rapid multiplication of virus. In case of CD4 cells, T helper cells count, it has been slowly decreasing. This phase lasts for few weeks. After that, HIV enters the asymptomatic phase. As the name indicates, no symptoms are experienced by the person. It lasts for several decades also. In weakened persons, it may exhibit in early. During this phase, the multiplication rate of the HIV virus is slow and the CD4 count has been increasing slightly. Next come to the last stage, that is AIDS. Here the multiplication of HIV virus, the domination of HIV virus is more. The count of CD4 cells has been gradually decreasing. It is about the different phases of HIV infection. If HIV is untreated, it leads to the AIDS, acquired immunodeficiency syndrome. AIDS is the advanced stage of HIV infection, that is the last stage. Mainly HIV virus targets the immune system and decrease the CD4 T cells count. Here, to know the functioning of the immune system, so we can measure the CD4, I mean T helper cells count. If the T helper cells count is normal, we can certify that there is no infection. If the number falls below the normal range, we decide that there will be some infection. Here, so out of all the lymphocytes, the CD4 T cells contributes to the, I mean they are account for the less than 14%. If CD4 cell count falls below 200 cells per cubic millimeter of blood, it will be decided as the person is affected with the HIV virus. Let's come to the symptoms of HIV infection. So what are the symptoms experienced by the HIV infected person? In head region, headache and difficulty to concentrate or difficulty to give focusing. Then the swelling of the lymph nodes in the neck region. Then rashes, fever and night sweats related to the skin. Then there are some discomforts regarding the respiratory system like dry cough, pneumonia, sore throat, and also nausea, vomiting and diarrhea related to the digestive system, and the nails become curved and thickening, and also person experience the muscle pain and joint pain. So ultimately it leads to the fatigue and weight loss. These are the major symptoms of HIV infected person. If the HIV reached the AIDS stage, some other diseases also occurs to the person, like encephalopathy. Another one is cytomegalovirus retinitis, which affects the eyes, ultimately leads to the loss of vision. Then pneumocytic girovisi pneumonia causes to the attack the lungs. Then chronic intestinal cryptosporidiosis, so attacks the intestine. The invasive cervical cancer. Then the next question we need to answer, how to prevent the HIV infection. Here the picturization of the prevention is given. So follow and listen carefully. First one, practice safer sex. During the sexual intercourse, the both male and female person must use the condoms and never share the needles which are used to the infected person or any persons. You always better to use sterile needles. Another one is you must avoid the multiple sexual partners. I mean have the sexual contact with many persons rather than one. Here the HIV infected mothers should follow the, should feed her baby with formula milk, should avoid the breastfeeding. The infected mother should not promote the breastfeeding. Next, drug treatment for HIV during the pregnancy. Some medication should be taken by the pregnant women to avoid the infection to the developing fetus. Then delivering infant by cesarean section. Here, the doctors do not prefer the normal delivery. So instead of that, they get the baby out of the female body by cesarean section. These are some preventive measures. Then what are different types of tests available for detecting the human immunovirus in the person's body? There are some antibody tests like ELISA. Second one is Western blot. The another one is rapid test. Some antigen tests like P24 antigen test, then polymerase chain reaction test. Then how to treat the human immunovirus or acquired immunodeficiency syndrome? There is better option, that is go for antiretroviral therapy. What is antiretroviral therapy? Here the use of a combination of HIV medicine to treat the HIV is nothing but antiretroviral therapy. Here, the HIV infected persons do not rely on any particular medicine. Instead of taking the single medicine, they go for taking the combination of medicines. That type of therapy is called antiretroviral therapy. So, what are the benefits of this therapy? Number one, it reduces the amount of HIV in the body, HIV infection. Then it reduces the risk of HIV transmitted to the other healthy person, and also it prevents the HIV from advancing to AIDS. It prevents the move of the HIV to the last stage, that is AIDS. Also, it protects the immunity system of the affected person. Besides this, some type of medications combinedly used to treat the HIV are given. Like there are almost 7 drug classes according to how they fight against the HIV. One is NNRTIS, second one NRTIS, third one is PLS, fourth one fusion inhibitor, sixth one CCR5 antagonist, fifth one, the sixth one is iron STIS, the seventh one post attachment inhibitors. These are the drugs used in combination to fight against the HIV. Finally, we look at the glance of sexually transmitted pathogens and their association with the diseases. Chlamydia trachomatis causes chlamydia infection. Then Neisseria gonorrhea causes gonorrhea infection. Treponema pallidum causes syphilis infection. Hepatitis B virus HBV causes hepatitis. Herpes simplex virus HSV causes genital herpes. Human immunodeficiency virus HIV causes HIV infection or AIDS. Human papilloma virus causes genital warts in the human being. These are 8 important sexually transmitted diseases given in the NCET textbook, how clearly detailed. Thank you for watching this video.